I want to learn the female better, starting from my wife, for example, daughter, mother, sisters.
That's actually inspiring to have a man want to talk about this topic. It's not something that's very common. When you understand the challenges, everything changes. We want to stay young.
Right.
We want our skin to stay fresh. We want our hair to grow. We want our joints to be healthy. And all of this is related to the hormonal shift that happens in women's body. You don't know how many women come to me at the age of 40 and 45, struggling since they were 15. It's very important for men and women to understand why PMS is such a big deal.
Fortunately, men don't go through that, and that's where men don't understand what female is going through.
Please remember that point, because you don't want to raise a husband who is not receptive. You don't want to raise a father who's shy to speak. You want to raise a man who is confident about his knowledge on this topic and who is comfortable in discussing it. This is something that men should understand. Before a woman gets pregnant, she needs to be ready to get pregnant, mentally and physically.
Even before we talk about male education,
Yeah.
are female educated on this subject? Unfortunately, we've had a very, very tough situation my wife had to go through. We had the child delivery. With his physical condition, he's just a body at the moment. It is in this situation that I have had to learn my lessons the hard way in terms of developing this connection.
It's not easy.
Good morning, Tina.
Good morning.
Thank you so much for joining me today.
Pleasure. Thank you for having me. I'm looking forward.
Thank you. So just to sort of set the tone here, male or female, we go through different biological changes throughout our lives, and they happen to be of different nature.
Yeah.
For male, there are hormones, of course, but the impact, the social impact, or let's say the emotional impact of those hormones is far less, in my view. When it comes to female, they have to go through menstrual cycle, puberty, after marriage, childbirth, after the child, the postpartum situation, and then menopause, and then the cycle continues on a monthly basis. And I feel they have to go through this at the same time when they're competing at workplaces as well in the modern society. And there's very little education. When I searched YouTube, for example, I couldn't find many videos around this topic discussing the element of how a male counterpart understands the female in terms of developing an empathy, developing empathy and a relationship at a deeper level.
Yeah.
So that's where I think there is a huge disconnect between the two sexes here. Through this conversation, I want to learn the female better. I want to create better relationships with all females around me, starting from my wife, for example, daughter, mother, sisters, and colleagues at her workplace. And I hope I can get deeper insights into how things work and how I can understand these things and develop those relationships.
That's actually, sorry to interrupt, that's actually inspiring to have a man want to talk about this topic. It's not something that's very common. We don't see it in our part of the world. And I'm so happy that this is our conversation today. And I'm sure that you will inspire many men who will watch or listen to the podcast, because definitely, like you said, when you understand how things work, when you understand the challenges of women in your life, whether it's your daughter, your wife, your sister, your employee, your colleague, everything changes.
Thank you everyone for your great support and comments on each of the episodes. We've been working really, really hard to bring you great guests and content. And it's only going to get better from here onwards. Your support means a lot to us. Do hit that subscribe button. Let's make it happen and make it count. Absolutely right. So let's talk about the female hormones, the nature of female hormones, and develop a very basic understanding how they work and what are the implications of those hormones.
Yes. Now, obviously, this would be like a 6 months course. I'm going to give you a crash course now.
Absolutely.
Like Hormones 101, in a way that everybody can understand. And by the way, you'd be surprised, but many women don't know those details as well. They go through them, but they don't know why they go through them. So just briefly, it all starts from the moment, we're talking women now, yeah, girls.
Yeah.
From the moment a girl, a female fetus is conceived. So you know that we as women are born with a fixed number of eggs, okay, to start with. And so the quality of the eggs and the quality of the fertility and the quality of the ovaries and the hormones is actually dictated or starts getting expressed and dictated from the moment a woman is pregnant with her daughter, which means even during pregnancy, what a woman is eating has an impact on the fetus or the female reproductive system. And this is something we didn't know of before. There's so many studies that have been done in this topic because there has been so many changes in female cycles in the age of puberty, which we call menarche. So the age at which a girl gets her first period, the average used to be between 11 and 13, and now we see that it's dropping. It's around 9.5, 10 years old, which is quite young. And so to jump to this phase of their life, because as a child, the girl as a child doesn't have major hormonal changes until the brain gets the signal that she's ready to get her first period. And this happens when there are certain factors that align, right? So it's the fat percentage in her body, the fat cells, the size and the number of fat cells, in addition to the readability in the hormones and the FSH and LH that are produced by the brain. So, there are few factors that come together and they tell the female body that she's ready to get her period, she gets her period. So the reason I'm talking about early puberty is because we see that lifestyle factors, environmental factors, environmental exposure to certain toxins, to certain chemicals are affecting the age at which a girl is getting her first period. And maybe you're going to think, so, okay, what's the big deal? She gets it at 9 or at 11. What's the difference? Huge difference. Because we also know that there's a lifetime for the reproductive lifetime for women. So the earlier she gets her period, the earlier she enters menopause. So there's this lifetime, right? And we want women to stay in their reproductive years as much as possible because estrogen, the king of hormones, is an elixir of youth. We don't want to age. We want to stay young. Right. We want our skin to stay fresh. We want our hair to grow. We want our inflammation to be low. We want our joints to be healthy. And all of this is related to the hormonal shift that happens in women's body. So by the time the girl reaches puberty and her body is ready, she gets her first period and then she enters the cycle, the female cycle.
The menstrual cycle.
The menstrual cycle,
basis,
which totals 30 days. And those 30 days are divided into 4 phases. And each phase is, now we're also working more and more on those phases to link them to dietary changes, to lifestyle changes, depending on the needs of the body. Now we know that, for instance, closer to period, what we call or what we still call PMS or premenstrual symptoms, why they happen and why some girls and some women develop PMD, which is premenstrual disorder, rather than symptoms. So it's a bit too advanced and sometimes they need therapy and sometimes they need intervention and certain diet intervention, supplement intervention. So this cycle, this menstrual cycle is the key to everything, because when women understand how their cycle changes and what happens at the beginning and at the end, we're not going to talk very medical, we're not going to give charts and graphs here, but it's important to understand that there's a shift in hormones that happens from day 1 to day 14, and then there's ovulation on day 14, and then from day 14 to day 28 or 30, she enters the second phase of her period, of her cycle, and then around day 27, she would get her period, and then she enters the cycle again.
Right. Let me understand the first 14 days.
Yeah.
What kind of hormones are released or are dominant in those 14 days?
So if we're talking day 1 is considered usually the first day of period, right? So let's make it easier for them. She finished her first period, okay? There's a release of a hormone in the brain. The brain is the master commander.
Yeah.
It's in the brain that everything starts.
The glands, I guess, right?
The hormonal production in the brain.
Yeah.
There are many glands in the brain, of course, that help with the production of hormones. Of course, there's production of hormones in the breast and the ovaries, but the master commander is the brain. So there's a hormone called FSH, which stands for follicle stimulating hormone. Okay. When this is released from the brain, it signals the body to start to be able to release, to stimulate. When we say follicle, it's the baby or the young egg. That's the definition of follicle. So we're basically telling this egg that is already existing, like we said earlier, we're already born with a fixed number. It's just that the maturation happens every month before the period, right? So we have those eggs, we have those follicles. So the stimulation happens through the brain. And then once it happens, alongside estrogen that starts increasing, so you see like an increase in FSH and a drop in estrogen, and this is where the release of the eggs happen. Okay, the egg is released from the ovary, it travels in the fallopian tube, and it sits in the uterus. Now here, at this moment, there's either fertilization, and so the production of an embryo, of a new life, or if there's no fertilization, this is where the period happens, right? And what the period is this sharp drop in the hormones. Before I tell you about the sharp drop, so after the egg has been released, progesterone, which is the other amazing hormone, starts increasing. Now, progesterone means progestation. It's a preparation for pregnancy, right? So what it does, it helps the uterus receive the newborn. So it thickens the endometrium. It creates an environment that is comfortable for a baby to grow in, right? Now, towards the end of the second phase, when there's no fertilization, the body decides that, okay, fertilization is not happening, we need to get rid, because if the body keeps increasing the endometrium and if there is no negative looping to the brain, that's problematic. And that's what happened with some women who develop endometriosis or other type of reproductive disorders. So once the other shift in hormones happens, and the brain knows that, okay, there's no fertilization, this is where the body starts releasing this endometrium in the form of blood. So it just gets rid of it.
That's the periods, basically.
That's the period.
Right. So there's so much that happens during that cycle.
Exactly.
I mean, it's and that's where I guess that there's so much happening to the female in terms of the
mood changes
and
physical changes,
and fortunately men don't go through that, and that's where men don't understand what female is going through. And this is the gap I'm trying to bridge in this conversation today.
Absolutely.
Let's talk about, again, the first 14 days, the release of the follicles and the estrogen. What kind of emotions a typical female would go through during this time?
Yeah. So the first quarter, which is the first half of the first phase, okay? This is where her abilities and her focus and her sharpness and her mood is at its best. And every woman who's watching would agree with me that right after the period is when the woman wants to go gym, wants to eat healthy, wants to go take major decisions at work, and rightfully. And then as she approaches the second half, so at the second quarter, let's call it, before the ovulation, the energy is a bit less, but she is still in her good zone. The first half is the good zone, right? Some hormones will change, some cravings start happening here. Women who are in sync with their body, they would feel the ovulation. They would actually get pain of ovulation, that moment when the egg is released. Some women feel it, not all women, some women feel it. And some women go through a mini PMS, if you want, during ovulation. So at day 14, she might have a bit of pain, she might get a bit moody, right? And then the egg is released, and then she enters the second phase. Now, the third quarter, which is the first bit of the second phase, is where she needs to take it easy, right? She needs to exercise. Cardio is great, for instance, at this time. She starts getting a bit emotional, okay, in that second part, because of the change, because of the increase of progesterone.
Progesterone, that's right.
Because progesterone is the soothing hormone, right? It's like the happy hormone, the chilled hormone.
Yeah.
And the wrong thing to do is for women, for instance, at this stage is to force themselves to do stuff. So listen to your body, chill. There are many more details we could give. I could share a graph or I could share a chart eventually with them. It's very interesting. And so when she enters the fourth quarter, this is where she is at the peak of emotional roller coaster. And this is what we call PMS, premenstrual symptoms. At this stage, there's a peak in something we call prostaglandin, which are inflammatory substances. So this is also what causes pain. It's a good inflammatory substance, obviously. And it's because of this inflammation or this inflammatory substances that the uterus gets the signal to pump out the endometrium in the form of blood. And the reason why I'm saying this is that it's very important for men and women to understand why PMS is such a big deal. It's not only psychological, like most men think like, yeah, she's moody, she's PMSing. There's a cascade of hormonal changes in her brain and in her body that are causing her to be this way. There's an actual increase, and it can be tested for like chemical increase of those inflammatory substances that hurt the back, that hurts the stomach. The amount of cramping that has to happen in the uterus to release the endometrium and the blood is very painful. By the way, there are some research that tell you that premenstrual pain can be as intense as giving birth. Yeah, in some women. So this combo of hormones in the PMS puts her in a very, very delicate mood. This is where we tell her, I always say, this is the phase where you should Netflix and chill, like really chill. Eat warm broth, eat warm soups, avoid harsh activity, relax, rest. Your body needs it. Your body is inflamed.
And what kind of emotions a typical female would go through during the periods?
Vulnerability. So during the period, I wouldn't describe the period 4 or 5 days as emotional at all. It's the right after, because actually when period hits, the hormones go down and she's more balanced. Some women, by the second day of their period, they're back on track, right? And this is where their sharpness starts. And the moment, now here's the thing. For a healthy reproductive system, or for healthy women who don't suffer from any hormonal imbalance, things happen as I just explained. But when they notice that things aren't happening this way and she's constantly emotional or she's constantly in pain or she's having the cramps throughout, this is where we know there's a question mark. This is a red flag for us. So the more in sync she is and the more in sync her partner is, or her whomever male person is in her life that could be support to her, the more they are aware and in sync of those changes, the more they can help each other find a problem at a very early stage. You don't know how many women come to me at the age of 40 and 45, struggling since they were 15, of very harsh PMS, erratic bleeding, and everybody dismisses them because on paper, on the blood test and the scans, everything looks normal. Sometimes there are subtle changes in hormones that wouldn't even show in blood test, but we can tell. From the symptoms, we can tell that, yeah, there's a bit of a shift we have to work on.
It's a huge roller coaster ride, it seems, from what I've heard just now. Of course, in most of the situations, things resolve and, it goes up and down and females get used to it. Two questions come to mind, of course. First one is, we're talking about male education here. First of all, even before we talk about male education, are female educated on this subject? Do they know themselves at a level they're supposed to know?
No. Listen, I'm a woman. Before I was a dietitian and before I was specialized in hormonal balances. What I knew about period was literally this. A girl gets her period once a month if she's not pregnant, because the egg that was not fertilized is propulsed from the body. That's the maximum information I got from my entourage, from my mother, from the education at school. At school, the reproduction and the sexual education at schools. And I was not brought up and raised in the GCC. I was brought up and raised in Lebanon. Even then and there, minimal. Yes, they would talk to us about sexually transmitted diseases. But why? Before we jump into sexually transmitted disease, we need to understand the female body. We need to understand what's the uterus. We need to understand what are the ovaries, what do they produce. Some women up until this age, my age, they don't know that there is something called, that they don't know, for instance, that it's normal for women to have testosterone in their body. In fact, it's an amazing hormone in their body. It helps with muscle building. It helps with libido. It helps with so many things. For them, they found testosterone in my blood test. It's not
Red
good.
flag.
And this, I mean, we will not blame anyone, but this has to do with the education very early on of the parents at school, in the readings. And I get many women, by the way, now, and I'm so happy when I get moms visit me with their young daughters just to sit and for me to explain to both of them what's happening in the girl's body. She's 10, she's 9, she's seeing changes in her body. The mother is not that comfortable explaining to her daughter. And talking about male education, nowadays more and more the father will join. Before it wasn't the case.
That's such an interesting thing. And now, talking about teenager girls in this situation, of course, I've gone through the situation myself. I have a daughter. I personally felt very, very awkward talking to my daughter about any of these conditions. And I've never managed to actually talk to her about menstrual cycle, for example. I've always thought that this is a huge taboo and, this is something that the mother is supposed to talk. Yeah. And I'm not even sure, frankly speaking, if my wife has been talking to her. I'm sure that she would have talked to her in a certain way. But, the reason I'm saying this is that I have never talked to my wife.
Yeah, about
it's such a shameful situation to be in that the level of communication that, that has been lacking between me and my wife in this instance, that, we've never communicated that this is a huge topic that needs to be communicated in the right way.
Absolutely.
So you're saying that, male counterparts in this situation, the parents, the fathers are joining in the conversations, and there is more conversation that is taking place.
Yeah.
That is a huge encouragement. And
listen, it's to answer to your not question, but you mentioned that you never spoke to your daughter about it, and it's also has to do with how much information you know.
Correct.
So if you are not educated, you will not come and speak about. What if she asks you a question you can't answer? Yeah. So this is number one. So this goes back to how you were brought up, to how we are raising our sons, right?
Absolutely.
So today I have a 10-year-old and I have a 15-year-old. If we're in the car and my daughter is going through her menstrual cycle, or she has to skip a swimming class because of her menstrual cycle, or we're discussing this topic, I never ask my son to leave the room if we're sitting, or I never postpone the conversation until he's not with us. And I do it on purpose because it's very important for us to normalize this talk with girls and boys equally. We cannot raise very smart, only well-aware girls and and educated females when it comes to reproduction, and just skip the male generation, because we won't be raising good husbands. We won't be raising good brothers. We won't be raising good employers. Because if a man has zero background and zero information and empathy towards what women are going through, and when I say are going through, by the way, I'm not putting women in a victim's position like she has to go through. This is the biggest blessing. Yeah. But there is things that women endure that not everyone know about, and they dismiss her. And so many women are not even employed because they're women, or because she's pregnant, or because she just got married. So they're thinking, oh, maybe she will get pregnant, so that will be less productive. And that's a completely different story. We can talk for hours about maternity leave and the laws and the rights of women. Yeah. But my point is, we should normalize this conversation in front of our sons, obviously, whenever it's age appropriate.
Absolutely. Now, talking about the teenagers, parents typically think that, the teenagers go through their tantrums. Female teenagers go through their own psychological issues, and because there's a huge change in biology at certain stage, and they don't understand how to handle that. The parents don't understand how to handle that. And there's a huge gap in understanding the overall topic, and it results in a lot of conflicts between parents and children.
This is very critical. In fact, I'm going to also show you another graph
Yeah.
about the life cycle of hormones in a female lifetime, right? And so in the graph, you will see that it goes flat, and then it goes like this, and it goes flat on the upper level, and it goes like this, and it goes back down. Okay? Now, the changes going up, this is puberty. The changes going down, this is menopause, and they are exactly the same shape. The difference is one is going up, one is going down.
Yeah.
So whatever a girl is going through during puberty, from mood swings, insecurities, changes in her body shape, changes in her appetite, changes in her muscle mass and physical performance, gearing towards fertility years or fertile years. The same thing a woman goes through, but going towards infertility or lack of reproductive years, which is menopause and postmenopause. But we go through the same exact changes at these 2 points in our lives. And a woman who's going through menopause or perimenopause, because perimenopause takes around 10 years and menopause is 1 day. It's the last day. It's the day where you've completed 12 months without period. So it's mostly we call it perimenopause because it's longer. So those changes, a woman in her 40s or mid 40s who today has a teenager should understand exactly what her daughter is going through, because it's really very similar. What's the difference? The difference is women around 50 or 45 have reached a certain maturity to deal with their emotions and to deal with their bodies and to get the help they need. Girls at this age don't have this maturity, and yet they're going through those changes. So we have to be extremely patient with girls, with teenage girls. We have to be extremely open. We have to be extremely very well receptive. We want them to talk to us. We want to listen. We want to know what's happening in her mind. We cannot judge them. We cannot overwhelm them with even more responsibility. The girls are going through so many changes in their brain and their body, in their identity, and so at so many levels that once we understand what's happening, it's much easier to deal with them.
I guess it starts with opening up a discussion from the parents, because typically a girl wouldn't open up, in my view, unless they see the sign that the parents are receptive to the conversation.
Absolutely.
I think it's at that point, it's the parents' responsibility.
Yeah.
And fathers need to chip in my view.
Absolutely.
Because it's a family situation.
Absolutely.
And if they understand their daughters better, there's a huge connectivity, there's a huge empathy and deeper relationship that they can create out of this exercise.
Correct. I agree.
Right. So let's say, female gets married in this part of the region, in this part of the world. They get married and they have children, of course. Elsewhere, they can have children. Otherwise,
marriage,
this in itself a huge step in a biological framework. Having a child, I have 4 children. I've seen alhamdulillah, I've seen the changes that my wife has had to go through. Unfortunately, I was not educated, I have to admit, in those situations to handle the situation better. I have come to a point in my life where I have developed this interest that, I have to understand this, to be able to understand my wife better, to be able to understand and develop a deeper relationship.
Absolutely.
So this is where the key is. Now, childbirth is a huge event in female's life. What kind of hormones are at play, and what kind of emotions are at play during this 9 months period, and how we can handle that better as husbands, for example.
Let me take you, before we dive into the pregnancy itself. This is something that men should understand, husbands especially, and fathers. Before a woman gets pregnant, she needs to be ready to get pregnant, mentally and physically. And to be ready mentally and physically, she needs to understand what preconception means. What does it mean? Now, put aside, obviously, with the sexual education, things have to be very clear, whether from the family or from the school or from the provider or from the GP or the pediatrician. A very clear sexual education should be done for women to understand their rights, to understand what they're going through, to understand all of it, okay? Assuming this is done, and she's married, and she and her partner decide to have children, it's very important for the woman to be ready to childbear, to be ready in terms of in terms of biology. Now, obviously, many women who did not even plan it, get pregnant, have normal pregnancies, give birth, life is beautiful, okay? But there's also a big percentage of deficiencies in women's bodies, hormonal imbalances, bad lifestyle habits, many factors that could be in her body or in her life that negatively impact pregnancy or the child or post-pregnancy recovery, post-delivery recovery. So that's why I always say a year before you're actively planning to be pregnant, get ready. Take your supplements. Don't go on crazy diets. Don't feel pressured to look in a certain way. You know how many women come to me and they tell me, I want to lose 10 kilos before I get pregnant? And
Wow.
I think this is extremely sad because the idea of wanting to lose weight so that the weight gain during pregnancy doesn't go crazy and she doesn't feel, like she doesn't gain a lot of weight. I understand if a woman is struggling with obesity or if her weight could negatively impact her pregnancy, absolutely, and I agree. And she has to find a healthy weight because she will get a healthier pregnancy. But to lose the weight just because I don't want to look fat or I don't want to, and plus to do it in a shallow way. Now, I'm happy when those women come to me to ask for the guidance because I would guide them and tell them what actually needs to be done. But when they go online and they download diets or they see professionals who are not even licensed to give them a diet to follow because, yalla, I want to get pregnant, so let's lose 10 kilos, go crazy on exercise, eat steak and salad every day, and then done, bang, she's pregnant with a million deficiency. A million deficiency means, and this is something also we need to understand, that during pregnancy, the priority goes to the fetus. So whatever baby wants, baby gets on the expense of her on the expense of her health, of her brain capacity, of her mineral status, vitamin status, muscle status. So the baby would take everything he or she needs from the mom, and the mom is left depleted, and they wonder why some women go through postpartum depression.
Yeah.
Because yes, they take the prenatal vitamins, fine. These are not enough. If you put your body in a trauma before pregnancy, and by trauma, I mean like harsh diets and harsh exercise and too much work and it's very difficult for you to recover and get over, because pregnancy itself is traumatizing to the body.
Yeah.
So yes, she has to be ready, and her husband needs to understand that he cannot ask his wife to just get pregnant in 2 months. If she asks him, but I need to take supplements, he needs to understand the importance, not only for the fetus, for the baby, for the embryo, but also for the mother and for her post-delivery health and being able to take care of the child, being able to breastfeed, being able to be in a, to prevent as much as possible postpartum depression.
I think during pregnancy, women get the right support from nearly all male, depending upon their situation, of course. There's better understanding on this topic.
Yeah, I agree.
Because
she's carrying his child.
Exactly. But unfortunately, the one topic that you've just touched upon is the postpartum situation, the depression that a female could go through. And that is real. And I was doing some research about 20% of the women actually go through postpartum depression. And that is very, very real.
Yeah.
Men don't understand. I've never understood, apart from my latest situation, the fourth child, and I'll come to that in a bit. But I think there needs to be better understanding on this topic. How do you come across this topic in your counseling sessions with your clients?
Listen, I mean, obviously, if I sense a postpartum depression, or if the woman is actually has been diagnosed with postpartum depression, definitely my first recommendation is to seek help from professional psychotherapist or psychiatrist, because she's not alone. There are millions of women who go through this, and there are protocols to follow, right? Now, in my area of expertise, it's very important for me to, what I highlighted earlier, that she is ready, that she has no deficiencies, that she's taking the right supplements during her pregnancy. And let me tell you something. I posted a video not long time ago. So one of the main vitamins that everybody knows, or every woman at a childbearing age would know, that before pregnancy, she needs to start on folic acid, right? We know it.
Rule of thumb, yeah.
Yes. Now, here's the thing. There's a very high percentage, I don't have the exact number, but I think around 70% of women who have a gene mutation called MTHFR. And with this gene mutation, their body cannot methylate properly, which means cannot use the folic acid in its basic form properly. And so these women need to take only the methylated form of folic acid. Otherwise, the folic acid they're taking will not serve them and will accumulate in their body. And there are certain studies now linking an accumulation of folic acid to postpartum depression, right? This is one thing. Another thing, and we spoke about depleting women's bodies. Female women who don't eat fish or who are deficient in omega-3 or who don't take supplements of good quality fish oil, omega-3 supplements, get into pregnancy with low levels. And the omega-3 is extremely important for the brain development of the child. So if the child, the baby, the fetus, doesn't get enough from the blood, from the body, from the the placenta, it reaches to the brain of the mother and it takes his or her needs from the brain. So after birth, the mom delivers with a deficiency, with a major depletion in omega-3 for her. And this is another factor playing a big role in postpartum depression. Now, when they come with postpartum depression, and if they're doing the therapy they need to do, we have to replenish these deficiencies. We have to clean up. We have to flush out the excess of vitamins and minerals she's been taking that are not serving her. We have to see what she's eating. Again, because that's another problem. And we will talk about diet in an episode alone, but it's very important to know when we tell women you need to eat for two, we don't mean you need to eat quantities for two. We need to double the quality for two.
Yeah.
So, and this is a very important thing because it plays a role in postpartum depression as well.
Absolutely. The reason that I developed this interest of having conversation with you when I looked at your profile was just this situation that my wife is going through in this instance. So the fourth child, unfortunately, we've had a very, very tough situation. My wife had to go through, she's still going through. She was admitted to the hospital because of the water bag leakage. She was in the hospital for 6 weeks, and then we had the child delivery who happened to be delivered at 30 weeks of gestational age. And he developed a condition called hydrocephalus, and that led into meningitis, and that in turn led into lack of brain development. Mm-hmm. So he's at 1 year age, and he doesn't have an active brain. His brain is not growing. With his physical condition, he's just a body at the moment. Very difficult situation for us as a family. It is in this situation that I have had to learn my lessons the hard way in terms of developing this connection.
It's not easy. I mean, thank you for sharing. Thank you for sharing your story because it takes courage. And this is something you're going through and it's fresh. And it's not easy on you. It's not easy on your wife. It's not easy on the siblings. I can only imagine what you're going through. And it's so, I think it's so brave to show vulnerability like this on your podcast. And yes, I respect so much that you turned towards your wife and you want to understand her better. Because, unfortunately, it's in these situations where conflict arises between couples, right? And to find strength in the situation and to find the motivation to understand your wife and be next to her is really an example for men, because we were discussing a bit of this before we started recording. And I remember I told you that it's so noble of you to think of this and to feel this empathy towards your wife. And women need this more in their lives, but also, and this is also a topic that we need to tap on, is that you as a man also need the support, right? You as a father, you as a husband. And the reason I'm saying this is because we shared our stories earlier. And the reason is I went through breast cancer and I went through treatment. And my main support and my backbone and my go-to person was my husband. And he was the one handling everything, you know? He was the one probably saying this, what you are now telling me, and feeling maybe emotional behind my back, not in front of me. And he was the one who everyone would go to and ask questions. And he was the one running the family and running the kids' drop-off and doing everything. But no one asked him how he was. No one turned to him. And this is, I mean, unfortunately, what I went through afterwards, he passed away from a heart attack.
It's a huge setback for
loss.
yourself.
It's a huge setback. Absolutely. It's not even a setback. I would call
I don't have any words to say anything about this.
My point
very,
is,
very unfortunate.
my point is, just as powerful it is for a husband to support his wife, it's also a call to all women, and entourage as well, to notice the man who is going through difficulty as well. Because it's the culture. The man has to be the strong one. The man has to be the tough one. The man can't cry. The man can't show. That's not true. That's not true. Because that's how the man will just build stress and affect his health and won't be able to support the family and
That's
support.
Right.
And when I say support, we're not talking financial support. We're talking emotional. We're talking mental. We're talking physical. Be there for them. So it applies both ways. But yes, definitely, now we're sitting, we're talking, and it's your wife now with your child at home going through this every single day while, luckily you get to go out and work, and interact and have a social life. So it's not an easy situation.
It's not an easy situation, and I've had to learn through the hard way. I mean, just taking a step back, I think I have personally come a long way in this journey in terms of understanding female around me. When I got married, for example, I had zero understanding of female biology other than, typical men.
Usual.
Understand, for example, there was very little empathy in terms of, wife going through a menstrual cycle, and we used to have a lot of fights during the time when she had periods, for example, and I guess that happens to many couples around because men don't understand female. They don't even want to question or understand, develop education around this topic, and they just expect the same result every day from the female.
Can I
very
interrupt you?
unfortunately.
Can I interrupt you? Because also a big responsibility falls on women as well.
Yeah.
Yeah. Because he doesn't know what he doesn't know.
Yeah.
So if that's the thing. So yes, she goes through PMS, and yes, she goes through these fluctuations, but that doesn't give her the right to victimize if she hasn't discussed with him her needs.
That's
or
also
she
right,
hasn't
yes.
communicated her needs. If she's just being defensive. And we have to also understand that men operate different than women because of many factors. So if you tell a man, I'm okay, for him you're okay. But if a woman tells the man, and maybe not while she's going through it, but on a normal conversation, while they're having coffee, on a one-on-one, she would explain to him, like, that we go through this, and we know what happens when we go through this. So this is why sometimes you feel like I am out of control, or you notice that my mood switches directly. It's really, some of it might be, from whatever is happening around me, but also some of it I cannot control. And so it's just this simple conversation that would make him accountable. But you cannot make him accountable if he doesn't know what you're going
That's
through.
absolutely right as well. I think there's, with the lack of education, there is huge lack of communication on this topic, because the kind of culture that we come from, there's a taboo around this topic. You're not supposed to have a conversation. Somehow it just turns out to be, what is it that you're talking about? You need to
What do I
hide these
care?
things.
Yeah.
Unfortunately, that has been the case, and unfortunately, not in our culture. I come from Pakistan, but in many other cultures, this situation exists, and the responsibility, as you've rightly said, lies on the female counterpart as well to open up. It's both sides. I think having
Yeah.
open communication, expressing themselves better.
Yeah.
If they're not able to express themselves better, they can't create empathy.
Yeah.
There's no receptivity from male part. I mean, if they don't hear anything, they don't see anything.
Absolutely.
It's absolutely no-go area for developing empathy. Between
Absolutely.
the
And
two.
this is why I want to repeat that for women and men raising boys, please remember that point, because you don't want to raise a husband who is not receptive. You don't want to raise a husband who thinks this is taboo. You don't want to raise a father who's shy to speak. You want to raise a man who is confident about his knowledge on this topic and who is comfortable in discussing it.
Yeah, absolutely. Now, postpartum depression, and then the next phase in a female's life is typically the menopause. You've talked
Perimenopause,
about it very briefly. Of course, there are emotional implications. There are implications again, in terms of the family and the relationships around. What kind of experience you have seeing your clients?
With
On this,
myself as well, and my experience, because I myself, because of my breast cancer treatment, I had to go through very early menopause at the age of 39. So again, now I am much more empathetic with women who are perimenopausal who visit me versus 10, 20 years ago when I would get a woman in her late 40s and she would explain what she's going through. In the back of my mind, I would be, it cannot be that difficult. It cannot be that messy. Well, it is so messy at all levels. Listen, what happens in her body, in the body of a woman when she enters perimenopause, and we're talking around 10 years before her last period, so it could be as early as 40 that she enters perimenopause. Obviously, the closer she is to the 50s, the more pronounced the symptoms are. Why? Because the lower her hormones get, because it's a small decline every year. So if we're going to go back to puberty that we discussed earlier and the changes that happen in the female bodies, remember I said that estrogen is an anti-inflammatory hormone, and that helps the brain release the FSH, which will release the eggs, etc. And then we spoke about progesterone being the chilled hormone, right? Now these two are declining closer to perimenopause, which means two things are happening. Again, as well as testosterone, which is the master muscle builder for women's bodies. These three, so what helped her build muscles, what helped her skin stay young, what helped her hair stay young, what helped her joints stay young, what helped her digestive system operate, what helped her libido, her sexual life be healthy, all of these are declining together at the same time. And guess what? They are declining at a moment, at a period in her life where she is at the peak of her career. She's usually raising teenagers or young adults who are going off to college. She is caring for growing parents. And she's going through midlife's crisis of her husband. At that same time, now you imagine what is happening in her brain, in her body, in her needs, in her frustration, in her pains, in her discomfort, this woman, for 10 years before her period actually stops. And guess what? 99.99% she goes to her gynecologist and she tells him what she's going through, and they dismiss her. Why? Because on paper, with her blood tests, things look normal, because that doesn't show. Perimenopause has no tests. And I say 99.99% because there is a very good number of gynecologists that I personally know who are doing an amazing job with educating women at that phase. But unfortunately, there is a vast majority who doesn't have the time to do it. So all these changes make for what? there are around 37 symptoms women go through in perimenopause. Brain fog, which is one of the most common symptoms, which is due to the estrogen decline, which is due to the receptor in the brain that lack the estrogen to hook on it. There's a book for Dr. Lisa Mosconi. Not long ago, it went out, a huge research they did, and they wrote the book called The Menopause Brain about the changes that happen. Brain fog, she can't focus, she can't concentrate. And remember, she's at the peak of her career, and she starts doubting herself. Am I good enough? Am I performing well enough? Number two, the estrogen decline and the anti-inflammatory effect of the estrogen that's declining is hurting her joints. She can't exercise the way she used to, right? She starts gaining weight because guess what? Insulin resistance increases at that age. And not any weight. She starts gaining weight in areas she never had before. The belly area, the hip area. Maybe she's not used to this body.
Yeah.
Insomnia because of the night sweats, because of the shifts in body temperature, because her body can no longer adjust temperature the way it used to be. Hair thinning, wrinkles, loss of muscle mass at the time where she wants her muscle mass the most because the bone density decreases.
Wow.
I'm telling you, this perimenopause phase is the most erratic phase in a woman's body because it lasts for so long. I told you about puberty.
10 years, you said, right?
I was telling you that puberty changes look very similar to menopausal changes, but one is going up, one is going down, right? But puberty is what, 2-3 years max? And it's not as intense as perimenopause. 10 years, she has to endure all this and go through all this and get dismissed by most providers, and not only provider, by the husband, by the colleagues, by the male employer, maybe. So this is why this conversation is so important. It's so important to be aware. And when we're aware, it doesn't mean we are changing the world. We are changing the female body. If we know things, no. But if we know, we can be supportive. If we know, we can change policies.
Right.
If we know, we can adjust, be lenient. If we know, we can understand. If we know, we can support, and we can get her to become more confident, more productive, not feel threatened for her job, not feel like she's lagging behind as a mother, as a daughter, as a wife. There are so many things that if we knew better, or if the community, the society knew better, women, although now they're doing an amazing job, but they would be 100 and 1,000 times even more productive and more successful at that stage in their life.
So in your counseling sessions, where do the male go wrong? I mean, during this period, of course, it's a tough one now, I think tougher than the previous periods.
Yeah, of course.
I guess.
Because just like I said, women would be at the top of her career and this is also a time of maturity in a couple. Yeah. So a time where they're supposed to be more free to do the things they want because the kids are grown and they're maybe left home, more free to travel together. And yet you feel that the wife is not as, because we see men at that stage going through midlife crisis, what we call midlife crisis. This is where the men start becoming healthier, looking after his body, looking after his nutrition, looking after his supplements, wanting to look better, wanting to live longer. Now the woman wants all that, but her body is fighting against her. And this is one of the main clashes I see with couples coming to me.
That is a huge one, by the way.
Of course, it's very frustrating for her because she would tell me, look at him, like he's never had six-pack. Now at 50 or 49, he's got the six-pack and I'm struggling to just keep my weight off. This is so unfair. And so if and yesterday I had a client who told me actually he's forcing me to do the exercise he's doing. Like he keeps telling me, you don't have willpower, look at me. No, she will not look at you because you're so different. Because you're not going through this mess in your hormones. You're not going through this mess in your brain. You are actually at the peak of your performance. She is at the bottom of her performance and she needs you to pull her up because she can reach the peak again, by the way, if she does the right things and she gets the right support and she changes the way she eats and she takes her supplements and she knows what kind of activity to do or not to do and stop the chemical exposure around her. There are so many things that she needs to do, but she can go back to her peak performance. But you need to support her.
When you say support, what kind of support is required here?
Number one, understand. what's happening with her. Number two, don't force her into things that are not good for her just because they're good for you. Number three, don't overdo it when you know she can't do the minimum. Just be more gentle with her. How? I'm not saying, okay, stop being healthy, obviously not, but don't forcefully start implementing new rules at home and being extra healthy when you know that she is struggling. Just show empathy. Like, tell her, I know how difficult it is. I know that now you feel like a good meal. Let's go out and have this good meal. I don't want you to feel guilty. You look great. You look amazing. And obviously you have also the sexual life and the sexual health that plays a big role when a woman is going through a sharp drop in her libido. And the man, on the other hand, is not going through that, right? And this is where they can seek therapy. And this is where they can seek professional help. This is another topic as well, which is not my area of expertise. But again, everything plays a role. This is where he can be supportive with the family, with the kids. Take a bit of the responsibility of the day-to-day, Let her do her own thing. Let her join a club. Give her more time to exercise. Don't ask of her the same things she used to do for you or for the house or for the community. She needs a break. This is a time where she needs a bit of a break. No, she doesn't need to retire. No, don't tell her, it looks like you can't keep up. Maybe it's a good time for you to quit your job. This is the worst thing you can tell a woman at this age. Because she's at the peak of her career and because she can be productive. And she is productive. She just needs the rights. She just needs you to take away some of the duties, the day-to-day. Because if I put a checklist now of what a woman does every day and what a man does every day, I'm sure you agree with me, the women's list is way longer with the little things that even he can do, but this is distracting.
And I think men go wrong hugely in this respect, demanding too much of their wives at times, or female counterparts in this respect. They ask for a lot, just assuming that female body is the same. If I tend to lose weight quickly, I would expect my wife to lose weight quickly as well. It's a huge mistake to make.
Huge.
You set her for a failure, set up for a huge failure, setting up an environment which is full of disappointment. Instead of that, understand the female better and cater for the, or
the changes,
for the changes around that. And that way, you not only eventually you'll reach your goal, whatever you want from her, but you will also have a healthy relationship. This is where most men are going wrong, and I'm one of them. And thankfully, I've come to a realization where I have taken steps and to fix the situation, and hopefully it'll result in a deeper understanding and relationship. Now, talking about you mentioned retirement and all that, workplaces, of course. We are in a work environment, and female are competing against men in the same roles. They're assigned the same targets. They have the same roles to play. If they have to get promoted, they have to show the same results. How can the companies help female in this respect, yet not compromising the performance?
Of course. That's a very good question. I'm glad you asked. There should be awareness sessions in any workplace for men and women equally to talk about what we're talking about. Number one, this should be implemented. It doesn't have to be weekly. It doesn't even have to be monthly, but there should be. They need to understand each other, number one. Number two, there should be better policies for maternity leaves. There should be better policies for period leaves, believe it or not. And I'm not saying every time a girl gets her period, she needs to take days off. No. But there are certain situations where some women are in bed, and this is going towards their holidays or their sick leaves if they have a medical report. Number three, there should not be any discrimination when it comes to married or not married or not pregnant, because let me tell you something. A mother, forget that women are extremely productive and extremely successful, but employers are mostly threatened by mothers because they have kids and they can get pregnant.
Yeah.
A mother is 1,000 times more productive than a single woman, only because, or than a woman who doesn't have children, only because she knows the value of time. And she knows that this time away from her kids has to matter. I'm a single mom. I'm a mom of 2. And ever since I got my first child, I realized this, that I don't want to be away from my child if it's not going to be valuable for me and for the company I work with. So I want to take full advantage. There is no messing up. There's no wasting time. I want this time in my company to be super productive. One, because I don't want them to say, oh, now she has kids, she's less productive. So we have something to prove. But number 2, because I want to be able to go back home and spend quality time for my children without feeling guilty that I did less at work. And so when the employer understands this, and by the way, it's not always male employers that don't understand it. Sometimes female employers also don't. If a female employer is not married or doesn't have children or doesn't have the same responsibilities, she tends to discriminate. Again, it's not personal against women, but it's because of how the company should run and times and maybe trips. And now, obviously, there are adjustments to be done. If the woman or the mother cannot travel as much, she can discuss it with the employer and they can change her work schedule and all of it. So there should be flexibility, right? But everything starts with education. It's not, it's easy to set policies, right? And we have to do it. No, you want to do it because you know the benefit on the long run it has.
There needs to be more education and discussion and dialogue between the companies and people around. And the subject matter, I think, should open up for discussions across the board.
Yeah.
And there needs to be more flexibility, yet not compromising the productivity, of course, at the same time. Now, I always talk about schooling. It's my favorite topic, actually. I know that some schools, actually vast majority of the schools here in Dubai would have some counseling for teenagers, especially for female teenagers. But do you think they are at a level where they should be in terms of promoting an open dialogue across the board, not only at school with the counselors, but also between children and parents?
Listen, it's getting better. It's getting better. Are we there yet? No. I know school counselors are doing a great job at counseling, whenever the child needs or the family needs. When we lost my husband, we did counseling at school with a counselor for my kids, and we did it outside school with outside counselors. It helped a lot. But it shouldn't be limited to traumas and major events and bullying and, she's going through it. No, it should be the norm. We should have meetings with the counselor just because. It doesn't have to be that, oh, I don't want my friends to see me going into the counselor office. They will think something's wrong with me, or they will know I'm going through. No, we should normalize sessions with a counselor for everyone at school. And I think 1 and 2 counselor in a school of 2,000 students is not enough.
True.
Why do we have 300 teachers and 2 counselors? We should have for every year group. It could be a counselor who's also a teacher or whatever, but at least for every 2-year groups, or maybe for middle school, couple of them for lower school, we should have more counselors to make them more available, to make them more available, basically. And we need to educate children on why you should see a counselor. Children still think that if they see a counselor, it's because something's wrong with them. No. Counselors can explain what could happen. Counselor can prepare them. A dietitian on board is very important. Also, a dietitian can educate boys and girls on puberty, on changes in hormones, on changes in the body. And I'm sorry, but a 1 session every year when you invite, I go to schools and I talk in schools, when you invite the dietitian to come and then you do it at a time where neither student can nor parents are interested, just because we have to do it, that is not
for the
working.
sake of it.
Yeah.
So
it has to be, in my opinion, it has to be in the curriculum.
Right.
These are the things that should be in the curriculum.
Right. So Maz is getting married this year. Any piece of advice for him to have a better, healthy and fulfilling married life?
Listen, you started at the right place. Today was a very good start for you. And I think if we're just open. You know, there are so many podcasts now. There are so many books. There are so many YouTube channels you can follow to educate yourself, to be open about it, you know what? And to tell your friends that you're doing it. There's no shame. I was telling you earlier, it doesn't make a man less men or less masculine
Absolutely.
if he knows about periods, or if he talks about period, or if he asks his wife about pregnancy, or if he talks to his daughter about puberty. In the contrary, it makes him more of a man, more of a support, more of an empathetic husband and father, and more of a role model.
True.
Can you imagine a son listening to his father tell his daughter, so the sister, about things and talking openly about puberty, about sexual life? Can you imagine what kind of sons you're raising? This is what we need.
Beautiful.
Yeah.
Beautiful.
Yeah.
And it can close many, many gaps in our social fabric, starting from the family. Family is the first place where you actually grow.
Yeah.
And if you have strong communication, strong relationships, deeper relationships,
That's it.
more empathy, it can help the larger social fabric, in my view. And this is where it all begins.
Absolutely. I agree with you. And I'm glad we did this conversation. And I hope many will listen and will watch this podcast, because this is our responsibility as well.
Absolutely. Absolutely. And next conversation we're having about the diet.
Definitely.
For the female in this context. And we'll be inviting you very soon. Thank you so much,
Thank
Tina,
you
for
for
being
having
with me
me.
today.
Such a pleasure.
It has been a huge learning curve for me today. Thank
Me
you so
too.
much once
Thank you.
again.
I just had the most interesting discussion on a Diary of a Founder podcast, and I really want you all to watch it till the end. Whether you're a father, whether you're a husband, a woman, a girl, a boy, watch this podcast, because there's so much to learn in terms of changes in women's hormones, in terms of support that they can get from the male, the males, the men in their lives. So watch it on all the podcast platforms, on YouTube, and feel free to connect with me on my social media handle. It's Tina Chagoury on Instagram, on TikTok, on LinkedIn, and I have my website, tinachagoury.com.